important concept in your drug distribution is nothing but volume of distribution. And finally, the significance of the distribution. These are the topics I'm going to cover in your distribution. And then, what is the definition of distribution? Drug distribution is defined as the reversible transfer of the drug. It is a reversible transfer of the drug between one compartment to another compartment. That is, blood to the extravascular tissue. And what is the significance of this drug distribution? The pharmacological action of the drug is depending upon its concentration at the site of action. In which site your drug will be go and act and produce its action. The pharmacological action will be completely depends on the drug concentration at the site of action. So the drug distribution is defined as the reversible transfer of the drug between one compartment to another. That is nothing but blood to the extravascular tissue. And thus the distribution plays an important role in onset of action, intensity of action, and the duration of action. So onset of action, intensity of action, duration of action, I will discuss it very clearly later. So what is the distribution process? Drug distribution process. Once a drug will be enters into the bloodstream, the drug is subjected to a number of processes that is called deposition processes. Okay, either it may enters into the distribution compartments, or else it will undergo metabolism, or else it will cleared out of, that is nothing but excretion or elimination processes. So it will undergo number of processes. These processes are called deposition processes. So the distribution, metabolism, and excretion, these three processes combinedly called as deposition processes. Deposition processes. So once the drug enters into the bloodstream, the drug will be subjected to number of processes. Those are called drug deposition processes, and they tend to lower plasma concentration. So distribution, which involves a reversible transfer of a drug between the compartments. So what are the steps in drug distribution? So the permeation of free drug through the capillary wall, and the entry of ECF, extracellular fluid. So your drug will be permeated through the capillary wall of the cell membrane, and it will be entered into the extracellular fluid. And the permeation of drug from the extracellular to the ICF, intracellular fluid. How the permeation will be happen to the membrane of the tissue cell. So here only two things are there. The permeation of free drug through the capillary wall, and it will be enters into the ECF. And then the permeation of drugs from the ECF to the ICF through the membrane of tissue cell. So here you have two types of rate limiting steps. The rate of perfusion to the ECF and the membrane permeability of the drug. So how the distribution process of a drug will be happen. See ma, in this picture you have a blood, ECF and ICF. Blood, extracellular fluid, and intracellular fluid. You have capillary wall and cell membrane. So the drugs which are having less than 50 Daltons will be enters into the intracellular fluid through bulk flow transportation. The drugs which are having 50 Daltons, less than 50 Daltons, will directly enters into the ICF through the bulk flow transport process. And the drugs which have lipophilic nature, the drugs which shows lipophilic nature, that is hydrophobicity, the molecular weight is 50 to 600 Daltons. These will enters from ECF to the ICF through passive diffusion process. And the drugs which will have hydrophilic nature or polar nature or ionized drug, the molecular weight of the drug will be greater than 50 Daltons. These will directly enters from ECF to the ICF through active transport. So the active transport, you already know the process. How the active transport will be? By the use of carrier, the drug transportation process will be takes place. In case of active transport, the carrier usage is there. With that carrier usage, the drug moiety will be join with the carrier and it will form a complex, and when it enters into the ICF, the carrier will be removed and free drug will be there for absorption. That is of active transport. So based upon the molecular weight and based upon the nature of the drug, either they are in lipophilic nature or hydrophilic nature or else normal size of the drugs. So how the passage of drugs between the ECF and ICF based on distribution process. So this is the plasma membrane barrier and drug diffusion or distribution across the plasma membrane. So this is the concept. So the distribution is a passive process. Why? Here the driving force, that is nothing but the concentration gradient, will be developed where between the blood and extravascular tissue. Distribution is a process for which the driving force, that is the concentration gradient, will be developed between the blood and ECF, extracellular fluid. Okay, the process is occurs by the diffusion of free drug. The process will be occurs by the diffusion of free drug until the equilibrium established, until the equilibrium between the blood and ECF will be established. And can you justify this? Distribution of drug is not uniform throughout the body. Why? Distribution of drug is not uniformly throughout the body. Why? Because tissue receive the drug from plasma at different rates. See, tissue receives the drug from the plasma at different rates and different extents. It will be based on kidney or liver. It will be based on kidney or liver, or else because of one second, distribution of drug is not uniform throughout the body. Why? Because that tissue will receive the drug from the plasma at different rates. It depends upon the organ size. Okay, Seema, here organ perfusion is there, blood flow is there, organ mass is also specified, and what is the normalized blood flow to the particular specific organ. See, here I mentioned that liver, kidney, CNS, myocardium and fat, etc. in case of organs. Okay, in the blood flow, in which type of organ it is showing more blood flow? Liver. Okay, the organ mass is also high, 2.5 kgs it will be. And the normalized blood flow is 680. This is the blood flow and this is the normalized blood flow. So generally without estimating, they have written this blood flow, and this is 680 is the normalized blood flow, that is ml per minute per kg. That means it depending upon the weight of the organ, and in normal blood flow it doesn't depend upon the weight of the organ. See the units here, only ml per minute. So how much ml will be transported through 1 minute or 2 minutes, and here the liver weight is also depending upon that blood flow. So for that reason, the tissue will receive the drug from plasma at different rates. It is also depending upon the weight of the organ, and the perfused rate, that is nothing but the blood flow to the organ, is also depending how much the drug will be perfused to that particular organ. So here you have different kinds of factors which will affect your distribution of the drugs. So majorly you have 4 types: tissue permeability of the drugs, organ or tissue size and perfusion rate, and third one is binding of drugs to tissue components and miscellaneous factors. In the first factor you have again 2 types: Physicochemical properties of the drugs you are going to read here. Tissue permeability of drugs, molecular size, pKa, and partition coefficient. And second one is physiological barriers to diffusion of the drugs. So first I will discuss about the tissue permeability of the drugs. Under the tissue permeability of the drugs, you have two major factors. First one is physicochemical properties of drugs and physiological barriers to diffusion of the drugs. These physiological barriers to diffusion of the drugs is very important in case of your exam point of view. And in physicochemical properties of the drugs, I think you may get some idea after that absorption. What are the physicochemical factors? Molecular size, pKa, and partition coefficient. First, I will discuss about this molecular size. So the molecular weight or size will be less than 500 to 600 Daltons, can easily pass the capillary membrane to the extracellular fluid. The penetration of the drug will be diffused, or penetrated from the ECF to the ICF is a function of molecular size, ionization constant, and also it depends upon the lipophilicity. And from extracellular fluid to cross the cell membrane, from this extracellular fluid, the drug will enters into the ICF. How it will enters? To cross the cell membrane through various aqueous filled channels. So aqueous pores, aqueous channels will be there for drug distribution. From ECF to the ICF, the drug will be transported to cross the cell membrane through aqueous filled channels, which need the particle size less than of 50 Daltons. So your drug for this pattern, that your drug particle should have 50 Dalton size, and the large molecule size drugs will be restricted or require specialized transport system. So the molecular weight of drug molecules have 50 to 600 Daltons will easily pass through the ICF, ECF to the ICF. And in case of drugs transport through the aqueous filled channels, the drug particles should have less than 50 Daltons. And then the pKa or degree of ionization. pKa is also called as the degree of ionization. The pH at which half a drug is unionized. The pH at which half a drug. Suppose your drug weight is 20 mg. So half a drug is 10 mg is unionized. That is nothing but pKa. So it will shows or it will tells us about the degree of ionization of the particular drug. A weak acid becomes unionized. Weak acid becomes unionized in a strong acidic environment. So your weak acid is having strong acidic environment when it will becomes an unionized form. And a weak acid will becomes ionized form. It will have a neutral or basic environment. Okay, if the weak acid will be available in the ionized form, it have that neutral or basic environment. If your weak acid will becomes unionized form in the strong acidic environment, and a weak base, simple opposite to the above one. The weak base becomes unionized in a strong basic environment. A weak base becomes unionized in a strong basic environment. A weak base becomes ionized at neutral or acidic environment. So the pH of the blood plasma, ECF, and CSF. CSF is cerebrospinal fluid. Cerebrospinal fluid. The pH of blood plasma, ECF, and CSF is 7.4. That is constant. So all the drugs ionize at plasma pH. All the drugs. Which type of drugs? The drugs which will shows the polar in nature and hydrophilic drugs will have ionization at all the pH ranges and cannot penetrate the lipoidal membrane. So the lipophilic drugs can easily penetrate through the lipoidal membrane, but all the drugs can ionize at all the pH ranges. Okay, so the degree of ionization always states you about the ionization or unionization pattern. So most of the drug will be available in the unionized form. So in case of polar nature or hydrophilic nature of the drugs, there may be a restricted perfusion. But in case of hydrophobic drugs, they are in lipid nature. So there may be these type of particles can get easily permeated through the lipoidal cell membrane. And one more important physicochemical factor in this drug distribution, that is nothing but the partition coefficient, O by W. Partition coefficient, permeability. So the polar and hydrophilic drugs are less likely to cross the membrane. Same statement here also there. And non-polar hydrophobic drugs are more likely to cross the cell membrane. So the effective partition coefficient, you can calculate it from this equation. So here what they are telling, only the non-polar molecules which are showing that hydrophobic nature, these will be more likely cross the cell membrane as compared with polar hydrophilic drugs. So the effective partition coefficient permeability can be calculated the equation of fraction of unionized drug at pH 4. Fraction of unionized drug at pH 4 is multiplied with partition coefficient of unionized drug. See, the effective partition coefficient will be calculated from this equation. The fraction of unionized drug at pH 7.4 is multiplied with the partition coefficient of unionized drug. In case of polar drugs, where there is a permeability rate limiting step, so the driving force is effective partition coefficient. So the drug molecules which will shows the polar nature, so there may have permeability rate limiting step. So these cases, the driving force will be the effective partition coefficient. After attaining the effective partition coefficient, the polar molecules can develop that driving force. This will be useful for permeability of the drugs from ECF to the ICF. So these are the factors which will affect your physicochemical factors which will affect your drug distribution. And one more important thing, lipoidal penetrate tissue rapidly. Lipoidal drug, that is nothing but lipophilic drug. Lipophilic drugs can penetrate the tissue rapidly among the drugs with same partition coefficient. So one which has less ionization show better distribution. So the drug phenobarbital is less ionized form. The phenobarbital will be available as less ionized form, but it will show better distribution as compared with salicylic acid. This salicylic acid will be available in ionized form, completely ionized form, and this phenobarbital will be available as less ionized form, but both are having same partition coefficient, but phenobarbital is having more unionized form and it will shows less ionization, means it definitely have more unionized form at blood pH. But this phenobarbital as well as salicylic acid both will shows same partition coefficient. See how the ionization will be influences your distribution, and highly specialized and less permeable to water soluble drugs. So these are of different kinds of physicochemical factors which will affect the rate of distribution. Okay, so in this distribution chapter, in this distribution chapter, you have to focus more on the tissue permeability. You have to focus on the different kinds of barrier, blood-brain barrier, blood cerebrospinal fluid barrier are there. And then you have to know the concept. Once the drug will gets absorbed from the GIT, then where the drug will enters and how the distribution will be. Okay, on the what basis? It will be based upon the polar or non-polar nature, or the size, molecular size of the molecules. And one more important thing, it will be based upon the pH conditions of the particular organ, either it may be stomach or intestine. So after focusing on these three parameters, you can able to know the drug efficiency, at which part it is showing more pharmacological action. So for this also, so this A, D, M, E, these four topics you have